The Chief Medical Director of the University of Calabar Teaching Hospital, Professor IKPEME, has reaffirmed the hospital's commitment to creating patient contact areas experiences that defines the human dignity while undergoing treatment. The CMD stated this while speaking to newsmen during facility tour of the hospital in Calabar.
The University of Calabar Teaching Hospital accounts for a total of 62 clinical and non-clinical departments, of which 38 wards and clinics. The CMD maintained that a facelift or complete remodeling of the facilities have been done to give patients the comfort while undergoing treatment. He said 7 years ago was on a mission and vision to rebuild, rebrand and restore the hospital with focus to creating pleasant patient experiences and infrastructure that exemplify the human dignity. According to him, the introduction of a 10-bed bill, each equipped with a dedicated nurse station to maintain a 1 to 10 nurse to patient ratio, a new policy regarding patient relative to ensure safety and clinical efficiency.
Take orthopedics, for instance. We do hip replacements, we do knee replacements, we do arthroscopy and sports medicine, shoulder, knee. So we can replace your anterior cruciate ligament. We've got the equipment, we've got the personnel, we've got the training, and we've got the space. So in gynecology and general surgery, we do keyhole surgery. I'm sure not many people know about it. We do keyhole surgery. So if your uterus is giving you a problem, we can take it out using a 1 cm incision and cameras and telescopes. We can take it out. If your appendix is giving you a problem, we can take out your appendix and the following day we send you home. We can open your brain and take out the tumor. We can do your spine. If you go to radiology, we're doing interventional things. We can drain a massive abscess just by using radiologic guidance. There are many, many things that we're doing here.
At the ICU unit, the hospital ranked one of the best state-of-art facility for critical ill patients' care. IKPEME said pride itself of about 6 new theaters under remodeling and construction and one of the best with a Tesla MIR 1.5 machine.
A 14-level ICU, and it is a world standard ICU that we can do and take care of critically ill patients here in this place.
The magnetic power of the machine is 1.5 Tesla. Manufactured by Canon. It's one of the widest in the nation, with the widest caliber for patients to pass through the couch.
As part of effort to address space constraints, especially within the emergency department, CMD explained that the new accident and emergency building has about 406 bed space.
The new Department of Emergency Medicine is a full 106 bed capacity structure. That's the roof you are seeing there. So it has a medical bay, surgical bay, trauma bay. It has a male ward, it has a female ward. It has children emergency. It has a 6-bed ICU. It has neonatal intensive care unit, and it's got 3 large trauma theaters, all inside that place.
Naming of the female and male ward of the hospital to some distinguished personalities described as foundation layers. The CMD explained that the action was to appreciate their role and contribution to the hospital.
In internal medicine, Professor Zelinachi decided to come. He took over from the Indians and he built a department, brought in other people, and over the years built and mentored a department. It is therefore to his credit that today the male medical ward, fully renovated, is being named in his honor. Dr. Obalo too was the first female internal physician from this place. She has inspired a generation of women in medicine, and she remains a teacher up until today. That to her credit, the female medical ward should be named in her honor.
The CMD and the entire management staff for this honor done to him.
For the opportunity to honor pathfinders and legacy members of this very distinguished department.
We know the condition of these wards over time, but for the able leadership of our Chief Medical Director, who has deemed it fit to give a facelift to this section of the hospital,
my department and I stand here with immense gratitude to the hospital management led by our able CMD, Professor IKPEME. So we want to thank you, sir.
Sunday Ina, Service News.